Good morning and welcome to your Weekend Healthy Chat. I'm your host, Dr. Sarah, and today's guest is Dr. Jay Spina from Dulcin Avenue Medical. Good morning and welcome.
Well, good morning to you.
So let's get started. So tell us a little bit about yourself and how you were interested in the field that you're in.
Well, as a young man or a young boy, I was interested in sports and wanting to stay healthy. And I was running and jogging and various sports. And I just had this feeling that I could help people in some way, and I didn't know how that would be. And as time went along, I saw my dad, who is also a chiropractor, saw how he could help people with their daily lives. And I kind of enjoyed the interaction with people. So as a result, I said, this would be a good choice for me. So I went ahead and pursued my studies in high school and then junior college, and then I went on to be a chiropractor.
Very nice. And how many years of training is that?
I was 6 years of training. 6 years of training, and I graduated from school in 1980. So I've been practicing 32, almost 33 years.
Great.
Yeah.
So tell us a little bit about Dulcin Avenue Medical Center. So what type of disciplines are offered there?
Well, that was a very good question. At Dulcin Avenue Medical, well, first of all, I worked as a chiropractor from 1980 till about 1995. So about 15 years, and I saw that it was going fairly well, and it was able to help a lot of people. At the same time, I noticed I also referred people out to various disciplines, whether it be physical therapy, an orthopedist, or a neurologist. And in doing so, I would notice that they'd come back and they'd not get the information that they felt they needed. I felt that there's a certain way that we should communicate to people and interact with people. But more important, the thing that really interested me the most and I felt real strong about was the word physician means teacher.
Right. Absolutely.
And so you have to educate patients about health and wellness.
Absolutely.
And they'd come back and say, well, this doctor said I need an operation. That doctor said I didn't. This doctor said I need this. This doctor. So it's confusing to the patient. They were confused.
Of course.
So as a result, I said, how are we going to solve this? So in 1995, I started by having other doctors work with me that had a similar philosophy. And it seemed to work pretty good.
Great.
And then at that time, the doctor mentioned we should also bring on physical therapy. And then a part of wellness, we brought on nutrition. And then we brought on acupuncture. Then we brought on massage therapy. And now we have a full center of healing. It's integrated healthcare where we have physical therapy, massage therapy, acupuncture, sports medicine, chiropractic, and our emphasis is basically on, and one, educating the patient so they understand their condition, and two, is a lot of hands-on care. Not go home and do your exercises and not do this or do that, but just kind of like work with them, and so whatever discipline they get a lot of hands-on care.
That's great. What ages do you service?
We serve, we have young kids come who have sports injuries or falls and slips, and we have people well over 90. Oh, wow. So that's not the majority of our people, but that was
quite the mix.
Yes, it is quite the mix. That's true. So we take care of people, I'd say, we take care of between 25 to 65 would be the main portion of our practice.
That's nice.
Yeah.
So I know you said your office has a variety of services, such as acupuncture, massage therapy, physical therapy, and chiropractic care. And you were talking a little bit about it, but how do they all work together, and what is the correlation between them?
Well, that's a very, very good question. Our main focus happens to be with, obviously, as you know, being a doctor, is an accurate diagnosis.
Absolutely.
And one of the things that is most important to me, regardless if it's my car or my house or my health, my personal health, I need to talk to and speak to somebody that can assist me in telling me what the cause of the problem is and what is the correct remedy to fix it.
Absolutely.
Many times, whether it's, I just had a refrigerator fixed and, we're going to try and put this in and it's $250 and let's see if that works. And if that doesn't work, we got another $1,400 part and let's see how that works. And it's like,
and it adds up and up and up.
Exactly. Yeah. And the problem doesn't get fixed. And it can be your car.
Yeah.
It can be, the brakes. I had this similar situation. I'm sure many people have with a car, or the noise in their car, or I have brakes in my car, or the lights on your dashboard.
Right.
And the same thing goes for your health. So the first and foremost thing is an accurate and correct diagnosis. So you know what the condition is, then there's a correct way to fix it. So that brings me to the next point that you asked me.
Yeah.
So someone comes in and they have a muscle problem, strain or sprain. Well, then either massage therapy or physical therapy might be good for that.
Right.
And if they have a pinched nerve, then a chiropractor might be good for that, or a sciatica type condition. Or if they had a shoulder condition, physical therapy might be good for that. Other people might need acupuncture because they have nerve pain.
Right.
And massage therapy would help muscles and tension and things of that nature. So based on the condition and the cause of the condition, we can give the proper therapy to remedy that condition.
And really tailor it down to exactly what's going on.
Exactly, because many people do come into our office and they say, well, we get a lot of referrals from doctors. Our office is doctor referrals, right? They go ahead and say, look, we gave you some pills and it didn't work, so now you need to go do something else.
Now we need to see sports medicine.
Exactly. Now you need to see whatever, right?
Right.
So they come to us and they go, I don't know why a doctor sent me here, because we're here already. I know I already tried this 2 years ago. I tried physical therapy for my shoulder, and I tried chiropractic last year for my neck, and it didn't work. All right, so now they're here, and they say, well, okay, let's take a look and see what's going on. So they go out and they get treated they see the chiropractor, and they see the physical therapist, and they come back, and I go, so how did it go? And they go, wow, this is unbelievable. I didn't know it was going to be like this.
Great.
So what's taking place is we do things a little bit differently, number one. And then number two is, it is truly, I believe, everybody's goal and purpose to help others.
Right.
Right? That's truly what we all enjoy doing and want to do. But it's really making sure that the person gets the care they need. And many times, a person might need physical therapy first and then chiropractic, or vice versa. Chiropractic first to help the pinched nerve, and then go ahead and give them physical therapy for the shoulder to rehabilitate it and strengthen it. So it's really, our expertise lies in, I think, a proper and accurate diagnosis, and then the proper treatments at the proper times in order to get them better.
The best success.
And get the best success. And I think that's our strong point, is being able to isolate the condition, because we do have a good team of experts. We get together twice a week. We go over every patient's chart to see how they're progressing.
Oh, great.
What's going on, what they need next. They should get more physical therapy. They can start physical therapy now. They should get an MRI. They should see an orthopedist.
Such a great team approach.
Yeah, it works good. So twice a week we sit down and we, get all the doctors together. And this way, I think we give the best care possible.
Great.
And that's the only reason I get up every morning, is truthfully, is to make sure people get better. I don't just show up there so I could entertain people.
Exactly. I know that feeling.
Yeah, that's right. You as a doctor understand that.
Absolutely. Now, does someone have to wait until they're hurting to come in to see you?
That's a great question. There's many different types of care, as you know, and it could be types of care for your health, types of care for your car, types of care for your teeth, types of care for your appendix, types of care for anything, right? There's people that go ahead and take care of it and maintain it and just take good care of things. They take care of their car every 3,000 miles. They get their gutters clean. They get their this clean.
Man, I wish I was on top of stuff like that.
Yeah, and they just take care of everything. So those people believe in wellness care or maintenance care. Then there's other people that come in and they get their problem corrected. They get in, they get out of pain, and they get out of here. Right? That's it. They come in, they get fixed, and they get out. And then there's the last type of person that's called crisis care. This guy only shows up when he can't move. He goes to the ER because his appendix is ready to burst. He comes to me because he can't move and he's bent over and can't straighten up.
Wait till the very last second.
And exactly. And then the guy with his tooth, and he's got to have his tooth pulled. So there's the three types of people, and we cater to all three types of those people, and we do our best to educate them so that they don't wait until the engine in their car blows up, so they have to get a new engine.
Right.
But that they can go ahead and understand the need for. See, somebody does something or doesn't do something for lack of understanding, right?
Absolutely.
They won't maintain their car because what's the big deal if I change my oil? What's the big deal if I go to the dentist?
Right, because they don't really understand what the whole purpose is.
Exactly.
Absolutely.
So our job is to try and educate them so they understand the benefits as well as the risks if they take this action.
Right.
And try and encourage them to do the best thing to achieve their goal. If they just want to go back to work, well, then that's it. If they want to go ahead and say, look, I want to be long and healthy, then that's that. I have a gentleman came in last week, and I said, so it's great seeing you. He says, I won't see you till next year. And I said, what's up? He goes, I'm going to Florida. I go, that's great. Where are you going? He told me he's going to Stuart, Florida, and he's going to come back in April. He'll see me in April, right? And I go, great, well, enjoy it. And of course, I said, your wife's going with you. Well, he worked long and hard 40 years. I'm not saying he's right, and I'm not saying he's wrong. I don't have an opinion on that. But what happened is his wife didn't take good as care of herself as she should have. So she's in a wheelchair. So she's going with him, but she's going to come back then and live with the daughter.
Okay.
Because she just can't move around.
Right.
So the point is I think for all of us, we either pay now or pay later.
Exactly.
You pay now to maintain it and take good care of it, and it'll last you a long time, or you pay later when you can't get out of the wheelchair. Or you can't get out of bed because you feel you're 45 years old or 55 years old, but you can't move.
No, absolutely.
So the choice is yours. That's why if you educate people, what the definition of physician is, means teacher.
Absolutely.
Is if we could go ahead and educate people so they take the best care of themselves, we're going to do great. And people will tend to stay healthy because I'd much rather see people who are healthy
Yes.
and I say hello and I see them once a
Yes.
month and they get a massage and adjustment. I say, how's everything going? Hey, listen, we're off to the tennis court. We're going to play tennis with the kids and then we're going to the soccer match
Right.
and then we're going versus them coming in and being grumpy
Right.
and can't move and complaining
Absolutely. And I
and
couldn't
then-
agree more.
and a lot of pain. So that's our emphasis.
No, perfect. What a great philosophy. And we'll hold right there and we'll be right back after this. Welcome back. I'm here with Dr. Jay Smina from Dulcet Avenue Medical, and we were just talking about a little bit of the services that are offered at his site. So let's talk about some conditions that you see on a regular basis.
That'd be great.
So say I walk in and I have back pain. So
Right.
how would you start the assessment or the process through your office? So what
Sure.
happens?
So we get to meet the person. We find out, what happened. Like, how did this problem occur? When did it occur?
Right.
How long they had it? Many times people, tend to not really look at the thing or the problem and, I had it. No, I never had it before. Then ask them a little bit more probing questions because, you need to be a good investigator.
Right, of course.
To find out the
Absolutely.
answer,
Yeah.
right? So then, I did have it last year. And then, maybe I had it 2 years ago. Or, I got a shot in my back before or something along those lines. So we find out what the condition is.
Right.
And once we find out what it is, then we look to find out the cause. So I ask them a series of questions. Then we do an examination of their spine so we can actually find out what's going on with the musculature of the spine, what kind of spasms there are, if there might be some vertebrae misaligned. If necessary, we have X-rays right in our office. We use digital X-ray.
Great.
Which means I see the X-rays in
In that second.
30 seconds,
Yeah.
right, exactly. And I sit down, I go over with the patient, and I can see, and they can see. You can
Right.
actually see when a vertebrae is out of alignment. It goes 1, 2, 3, and the fourth vertebrae is way off to the side. And they go, oh, that's the problem right there, doc. Or they go, doc, what's that? Right?
Exactly.
So then we go ahead and find out what's going on with that. If there's heat or ice that might be appropriate, we might use that.
Okay.
We have a massage therapist. We might use various ointments. They might get chiropractic care. They might, some people walk in and people have different things that have worked for them in the past. Meaning some people walk in and what's worked for them is, some people walk in and they go, I only want to see a chiropractor. Some people walk in and say, I don't want to see no chiropractor, just want medication. So everybody has
Right. An
what worked
idea
for them.
set up of
yeah,
what.
so they have an idea. So we work with their idea, and then we go from there. So if it was somebody who wanted, like, look, I really don't want any pills. I've been taking Motrin for 2 weeks, and I want to stay home. I want to just kind of, get this thing fixed. We do an evaluation. We take a picture. We show them to the picture, and we might begin some massage or heat or ice and some chiropractic care. And usually they notice relief pretty quick. If you slammed your finger in a door and you opened the door, your finger would feel relief the minute you opened the door.
Exactly.
Well, it's the same way with chiropractic. If a bone slides or slips out of alignment and it pinches a nerve, and you put the vertebrae back in alignment, they're going to start to notice relief pretty quickly.
Would that be something they'd have to come in multiple times for? Or is that something that you can realign right then and there?
We start the process right then and there. Typically, because people tend to neglect themselves, it is a bit of a process. They need to come more often. But we explain to them there are several phases of care. The first phase of care is relief, is to get them out of pain as quick as possible. So we do everything we can to get them out of pain. Then the next thing we ask them is like, look, we got you out of pain here. Your back might be a little bit unstable and weak, so we might want to go ahead and give you some care to correct or stabilize your back so the same thing doesn't repeat itself. At that point, you're free to go. Other people say, you know what, I'd like to come once a month or so just to kind of get a checkup and keep it in shape, much like people do with changing oil in their car, their teeth, aligning their car, just to kind of keep in good shape because people are bending, twisting, turning.
Oh, yeah, of course.
And abusing themselves, so they would like to do that. So there's, back to the 3 philosophies, there's 3 phases of care, and a person would go ahead and check, see what phase of care they'd like, and most aligns with their lifestyle. And a large part of our practice is wellness and health. It's just that they understand. We spend a lot of time educating them so they understand, and they want to stay healthy.
Right. They want to maintain as best as they can. Absolutely.
Right. They want to live a better life. There's no, like, I had a guy, Jake is his name, the other day, probably came into me, he said, hey, doc, I came in a bunch of times this year, and I go, I go, great. Is everything good? He goes, it's great. I did just what you said. I go, what do you mean? Well, I came 10 or 15 times this year, and I didn't have pain one time. I came 10 or 15 times last year, and I had 4 episodes, and each time I had to come 4 or 5 times. So he came the same amount of times.
But it was more maintenance than it was.
And he didn't have any trouble, and he didn't miss any work, and he wasn't in pain, and he didn't have to take any medication, and.
Yeah.
So in the long run,
Yeah.
The old story, the old adage of an ounce of prevention is worth a pound of cure.
Oh, yes, absolutely.
Right.
Now, being a pediatrician, I see a lot of teenagers, and I have a few that have scoliosis. Now, is that something that you see in your office as well?
It is. Yes, it is.
And what type of treatments do you advise for that?
Well, when scoliosis comes in, it depends on their age and at what point we catch it. If you got 17 or 18 years old, it's less
past puberty, I know.
Yeah, it's a little less likely to be addressed. On the other hand, if they're a little bit younger, and 12 or 13, and they're still growing, between the exercises, some chiropractic care, some massage therapy, some stretching, we can kind of help that out and trying to prevent that from worsening. So we've had pretty good success with that. They see, many times they'll see the orthopedist and he'll monitor and measure their progress.
Right.
And the parents come in and they'll tell me, it's 5 degrees less than what it was, and they're all happy.
Good.
So that's a good thing. So it is something.
Now, do you receive a lot of referrals from orthopedics or from the general practitioner like myself as well? It's a good mix.
It is a big mix. Yes,
Good.
We do get some. We do get some from pediatricians. We do get quite a few from orthopedists, and then also quite a few from PCPs or their family doctor.
Right.
They say, hey, look, this isn't responding the way we'd like. Just to continue to take medication isn't working. Why don't we go ahead and here's the truth of the matter. Health is composed of 3 parts. True?
Absolutely.
There's the physical part.
Yep.
There's the chemical part, and there's the mental and emotional part.
Yes.
That's right. So there's all those parts. And if you have all those parts, those 3 parts is 100% health or wellness. Now, many people come in, and I don't know, an example of a physical problem could be, God forbid, a sprained ankle, a broken ankle, a bone out of place, a spasm in your back. A chemical problem could be something like diabetes, where somebody's got to take insulin. The body doesn't balance its blood sugar. And a mental or emotional problem could be the death of a loved one, or their dog ran away, or whatever the case may be, a divorce or some upsetting thing, loss of a job, something like that. So people come in to get treated, and they're taking some sort of chemical, but they have some physical problem.
Right.
So if you have a physical problem, you need a physical remedy.
Absolutely.
If I walked into your house and I said, hi, Dr. Sarah, it's great seeing you today. And I say, you must have something stuck in your toaster. I see some flames coming out, and you must have a bagel in there, and it's stuck in there. And Dr. Sarah says, oh, don't worry about that. Why don't you just go flush the toilet? I say, what a bizarre thing that is to do. Well, much like a person taking medication, when they have a pinched nerve, it might kill the nerve so they don't feel the pain, but it's not going to fix the problem.
No, absolutely.
So
you have to get to the root of it.
Right. Your physical problem, you have a physical correction. If you have a chemical problem, some sort of imbalance in your body, you take some sort of medication and or vitamin or mineral or whatever. And if you have a stress or some situation like that, you see somebody to help you with that.
Right.
So we deal a lot with the physical problems, and many of the doctors realize, hey, look, this is something that's not just a little strain. Go over to our office, and they'll get you fixed up. Because one of the 3 things are going to help you: either chiropractic, physical therapy, massage therapy, acupuncture.
Right.
One of those things is going to address your physical problem, and we'll be able to help you and give you the best care possible.
Great. No, that's perfect. I have a lot of teenagers who are very heavily involved in sports. Do you deal with a lot of sports injuries?
Well, we do. We do, because one of our doctors...
I swear, every week I have somebody in there with an ankle sprain. They hurt their knee. I mean, it's always something, I feel like.
It is true. And, they're very active, 12, 14, 15, 16 years old.
And they're growing, which makes them vulnerable to so many injuries.
And so they come in, and what we do is we give them care right away and get them taken care of right away. We have a couple really good sports guys on our staff. One of the chiropractors and two of the physical therapists, and one of our doctors also worked at the Ironman in Hawaii. So she's
excellent.
She's got a first-hand experience on how to take care of people. And for the most part, we can get them in and get them taken care of, give them a little rest, give them a little heat, give them the proper thing, and get them back in sports as quick as possible, because they hate to be out of sports.
Oh, I know. When I write kids out for gym or sports times 2 weeks, it's like the end of the world.
Exactly.
But if they were missing school for 2 weeks, I'd be excited about that.
That's true.
Gym or sports, forget about it.
Exactly.
So keeping on with some of the conditions that you treat on a regular basis, what about sciatica? How do you go about that approach if somebody came in with that type of complaint?
That's a great question. Well, sciatica could be pain from the lower back and or hip, and it affects the nerve that goes down your leg. And some people exhibit like numbness in their feet. Some people have cramps in their calves. Some people just have pain down the back of their hamstring or back their upper leg. So it could be exhibited in many different ways or manifested in different ways.
Right.
So what we do is, again, we do an examination. We find out what's going on with their back, and their pelvis can be misaligned. We take a look at that to make sure it's not muscle, it's not a strain, and it is a nerve problem.
Right.
Many times it could be there's people have, our big concern today is people have some sort of disc problem. And the information on that is, people have different ideas or thoughts about that. But we find out what's causing it. And once we're able to isolate the cause of the condition, then it's something that's easily remedied. If we have the spot on diagnosis, then we can give them the care they need and make sure they get better. And so sciatic is something that responds pretty well to what we do. It's a pretty common condition.
So it sounds great, and all the philosophies and everything. It sounds like an excellent center. So I just want to thank you for being on our show. And if you just wouldn't mind stating what the actual location is and how people can get in touch with you.
Well, that'd be great. We're in Middletown on 54 Dulcin Avenue. They could reach us by 845-342-0000, or you could reach us or find out more about us from our website, which is dulcinavenuemedical.com.
Perfect. Yeah. Well, I just want to say thank you so much for being on the show today. It was truly a pleasure to have you.
Well, thank you so much. I appreciate it.
And I'm sure I'll be sending patients your way very shortly.
Well, thank you very much.
Take care. And we'll be right back after this. Welcome back. Now's the time in our segment for our email question of the week. This comes to us from a concerned mom, and she writes, Dr. Sarah, I'm worried about my 2-year-old. He's very smart and understands everything you say to him, but he's only speaking about 20 words. My 4-year-old was speaking full sentences at that age. Help. Should I worry? What should I do? Well, thank you for your question. This is one I get frequently in the office. Let me start by saying the fact that he understands everything is an excellent sign, meaning his receptive language is absolutely where it should be. The fact that there is an older sibling in the house who very much likely speaks for the 2-year-old could be a big reason of why his expressive language is slightly lagging. With that said, at age 2, ideally he should be putting 2-word phrases together. If he is, great. If not, I talked to your pediatrician about having him evaluated by early intervention to see if he qualifies for speech therapy. But again, the fact that his receptive language is appropriate, I wouldn't worry too much. He will catch up to his sibling in no time, even if a little help with speech therapy is needed. I hope this helps ease your mind and answer your question. For those of you with further questions, please feel free to email me at drsarah@middletownchc.org. Again, that's DRSARA@middletownchc.org. Or if you'd like to discuss any concerns face-to-face, I'm located at the Port Jervis Center for Primary Care, which is located at 140 Hammond Street, Port Jervis, New York, where we are always accepting new patients. I just want to say thank you again to Dr. Jay Smina from Dulcin Avenue Medical for being with us today and discussing the work that he does at his center. So thank you. And as always, have an active and healthy week ahead, and I'll see you again next time. Take care.